This is honestly how many diabetic consultations go down in medicine today. So let's say you have a 10-minute consultation with your doctor, and I accept 10 minutes is not enough, but let's say you do. What will often happen, let's say you're coming in for the first time, you're going to find out that you've been diagnosed with type 2 diabetes. What will often happen is that the doctor will say to you, hey, Mr. Smith, you did these blood tests, I've got some news for you. Your blood sugar is elevated, it's in the range that we would call type 2 diabetes. Now, nothing to worry about, it's very common, but we've got medication for you that we can help you with. We'll start you off on something called metformin. Within a year or two, if needed, we'll put you on a sulfonylurea, and a lot of patients ultimately need to go on insulin, but we'll get there in a few years. Don't worry, but we'll be monitoring you throughout, and we'll be adding to your medication as is necessary. And then as the patient leaves and is about to walk out, the doctor might say, oh, and if you can lose a bit of weight and go to the gym a bit, it will help as well. That is honestly how so many diabetic consultations go down in the NHS today. I can say this confidently after 23 and a half years ago now, since I first qualified and started practicing. I just don't think we're very good at chronic disease. And I actually think we make a lot of people worse without actually realizing it. That case study diabetes I mentioned, if you don't empower that patient at the start, you've made them dependent on us as a system. You said, oh, you have to take this medication and we'll be the ones monitoring you, a very paternalistic approach. What's great about biohacking and the longevity movement, I would say there's many good things about it, but the core aspects of it I love the most is that it's about people taking ownership of their health and saying, actually, there's something I can do. I'm going to do certain things. I'm going to test them. I'm going to see if they work. And if they work, I'm going to continue. It's the polar opposite of how we are trained as doctors to practice.